People with normal cholesterol also get heart attacks. Even people with low cholesterol get heart attacks. Why is that? Half of all heart attacks are from people with normal cholesterol. Hi, I'm Dr. Kevin Ham from Vancouver, Canada. Cholesterol is a gold standard in which doctors measure to assess your risk of whether you get a heart attack or a stroke, whether you have heart disease. Cholesterol, especially LDL cholesterol, which stands for low density lipoprotein, otherwise known as the bad cholesterol, is the culprit blame for plaques in your arteries. But that doesn't tell you the whole picture, because why do people with low or normal LDL cholesterol get heart attacks? And some people have really high LDL cholesterol and they don't get heart attacks and they don't have plaques. So this has been a mystery. But before I explain that in another episode, I want to tell you the 3 blood tests that you can do that gives you a much better measure of your risk of heart attacks or strokes. Number 3 is something called C-reactive protein. Short abbreviation is CRP. This is a protein made in your liver, and it is a measure of general inflammation in your body, systemic inflammation. Now, why is inflammation important? Because if you do have plaque, when you are highly inflammatory, then that plaque is unstable, and it can make your plaque burst because it's unstable. And when it does burst, it creates a blood clot that then blocks the rest of your blood vessels, stopping blood flow and causing heart attack or stroke. 70% of heart attacks are actually caused because of unstable plaque. They don't obstruct the artery very much because they're early unstable plaque in an inflammatory environment. The obstructed plaque, you are already seeing signs of whether you have shortness of breath, weakness, symptoms. So that is more predictable and the signs are there. But that's only 30% of plaque. And those are stabler, harder, obstructive plaque. So the CRP, if your number is greater than 3, it means you are highly inflammatory, and so you're at high risk. And if it's less than 1, you're very low inflammation and low at risk. I've gotten my CRP down to 0.2. That's almost 0. The number 2 best blood test to see if you are at risk of heart attacks is something called lipoprotein A, so LPA. Because some people have normal cholesterol, they are genetically predisposed for producing more lipoprotein A. So lipoprotein A is a type of LDL with a little protein extra attached to it called apoprotein A, therefore lipoprotein A. And if your lipoprotein A is high, even if your LDL is low or normal, this is a dangerous type of lipoprotein that does cause plaque, can cause plaque, gives you a high risk of plaque and therefore heart disease. I thought I had high lipoprotein A because I had such severe plaque in my arteries here, in my heart, in my neck. Lipoprotein A was actually normal. So I was surprised. It was mostly my bad diet in my teenager years, 20s, up until early 50s where I stopped eating fried food. So lipoprotein little a, you should get a measure at least once to see where it is. And this one is much harder to change by diet or exercise or any lifestyle. It is possible, but it requires specialized knowledge. And the best measure to predict your heart disease is ApoB, so apolipoprotein B. Now, why is this the best measure? Because LDL is just measuring the concentration of cholesterol inside these LDL, the low-density lipoprotein. It's like instead of measuring all the cars on the highway, it's just an average number saying there's only 1 passenger per car. It's only telling you a concentration of cholesterol in your LDL. ApoB, what it does is actually numbers how many cars are on the highway. How many apolipoprotein B? This ApoB is in every type of lipoprotein that can cause plaque. So it's a much better measure than the average concentration versus the actual particle count of lipoproteins that can cause damage and plaque. So the more cars are on the highway, there's a higher risk of car accidents. If there's only one car on the highway, it's virtually impossible to have a car accident. And so the higher number of ApoB particles there are, you have a higher risk. So this is probably the number one test you can get to assess the risk of getting plaque and therefore heart attacks and strokes. So again, what are the three best tests that are much better than total cholesterol, LDL cholesterol, HD cholesterol, triglycerides? Number 3, inflammation marker, CRP, C-reactive protein. Number 2 is lipoprotein A, which is a genetic risk factor for lipoproteins that cause plaque and hard to modify by lifestyle. And the best measure, if you had to just choose one, is apolipoprotein B, or ApoB for short. Now, if you ask your family doctor or your doctor to measure any one of these tests, they might not know because they're so used to just measuring LDL, HDL, and total cholesterol and triglycerides, what we call the lipid panel. But if you really want more accurate measure, these are the 3 blood tests to ask your doctor to get.